La Escuela de Medicina y Ciencias de la Salud se fundó en Monterrey en el año de 1978, y es ahí donde está el Centro de Innovación y Transferencia en Salud, el Hospital San José y el Hospital Zambrano Elion. En Ciudad de México se encuentra la Unidad de Investigación de Enfermedades Metabólicas del Instituto Nacional de Ciencias Médicas y Nutrición, Salvador Subirán. En la ciudad de Guadalajara, el Centro de Ciencias de la Vida. En Chihuahua, la escuela es parte de Tec Salud, integrándose también el Hospital San José, Hospital Zambrano Elion, institutos y Fundación Tec Salud, formando un centro de atención, educación e investigación. Ser la mejor escuela de medicina y ciencias de la salud de Latinoamérica es nuestra visión, enfocándonos en bienestar, prevención y longevidad. Nuestros programas académicos: médico cirujano odontólogo, licenciatura en nutrición y bienestar integral, licenciatura en psicología clínica y de la salud y licenciatura en biociencias. 17 especialidades y subespecialidades médicas, 30 cursos de alta especialidad, una maestría y 2 doctorados. Nos caracteriza nuestro modelo educativo innovador, creando una experiencia transformadora con alianzas educativas en todo el mundo, 8 grupos de investigación con enfoque estratégico y más de 50 alianzas educativas en todo el mundo. Sociedades académicas para monitorear y apoyar a los alumnos, posicionándonos dentro de los primeros 5 lugares en el examen nacional para aspirantes a residencias médicas. Nuestros programas cuentan con acreditaciones nacionales que respaldan su formación, siendo la primera escuela privada que tiene convenio con la Secretaría de Salud del Estado de Nuevo León, a través del programa multicéntrico. Y somos la única universidad privada en México que figura en el ranking QS de Medicina en Latinoamérica. Ahora que nos conoces, explora, elige, libera tu potencial transformador.
Buenos días, tengan todos ustedes. Soy el doctor Oscar Valencia, coordinador de este espacio de educación médica continua. Y antes de dar inicio a nuestra sesión, les recordamos mantener en silencio sus micrófonos. Todas las preguntas las podrán hacer a través del chat. Les pedimos que también pongan su nombre completo en la pantalla con el fin de tener su nombre para los certificados. También les pedimos que nos haga favor de llenar una encuesta de satisfacción al final de esta sesión. En nombre de la Escuela de Medicina y Ciencias de la Salud del Tecnológico de Monterrey, les doy la más cordial bienvenida a nuestra sesión académica de pediatría. Hoy tenemos una invitada especial que nos va a hablar de liderazgo. Como médicos tenemos que asumir esta responsabilidad, y la doctora Ming-Ka nos va a hacer favor de impartir esta sesión. Me voy a permitir dar una pequeña reseña de la amplia trayectoria que tiene la doctora Chang, y lo voy a hacer en inglés para que ella también nos lo pueda escuchar. Dr. Ming-Ka, she's a Chinese settler, grateful to be living and working in Treaty 1 territory homeland of the Métis Nation, known by some as Winnipeg in Turtle Island or Canada. A pediatrics clinician educator at the University of Manitoba, her scholarship focus on leadership education and social justice in the health professions. As a co-director Office of Leadership Education for Rady Faculty of Health Sciences, she works collaboratively to promote leadership and education across the educational continuum in the 5 health colleges. She is also the chair of the Sanokondu Leadership and Governance Team, a multi-nation community of practice focused on health leadership education. On behalf of the School of Medicine and Health Science of Tecnológico Monterrey, we'll give you the most warm welcome, Dr. Ming-Ka. We're very happy and glad to have you with us. So I'll give you the floor.
Thank you so much. So I'm really excited to be here, and thank you for the introductions and letting me know who's in the room and what some of your roles are. So I'm hoping to spend a little bit of time talking about physician or health professional leadership education, and really how developing your why. So Oscar's, after his warm introduction, you know a little bit about me. And one of the things I reflect on is that we often share what you see here in red in our public settings. And I'll share a little bit additional to reflect the my intersectionality. So my pronouns are she, her, and hers. I'm cisgendered. And I'm married to a community gastroenterologist, and we have two wonderful teenagers. Well, actually, one's an adult now. And I think what it really does in sharing this is it helps you see how I see and interpret the world. So I'm coming to you, and I was talking a little bit before about the weather. I'm coming to you from Turtle Island or Canada, and you see I'm right in the middle of the country. And so we're a little bit north of you in Mexico. And you'll see an image of my campus. We do have some it's a beautiful land. It's the homeland of the Anishinaabe, the Cree, Oji-Cree, and Dene peoples. And as you can see, we have some beautiful landscapes, although currently right now, we don't have quite as much snow as you can see here to build a snow fort, but we're having temperatures well below zero. So in Turtle Island or Canada, we are working towards truth and reconciliation. And I shared a little bit about the lands, the original lands. And one of the reflections as a pediatrician that's very important to me in this journey is reflecting on two specific contexts that I'll just share with you about why this is important. So one is the missing and murdered women, girls, and two-spirited peoples. And also here, you've probably heard about the thousands of children who've been found from uncovered in burial sites across residential schools across Canada. And while these are deeply saddening and horrifying, these art images from artists across North and South America really reflect some of the beauty in this time. So I don't have any commercial conflicts of interest to declare. I will say that I am funded by my Royal College, and I have some local grants for educational research. And I am paid by the Canadian Association for Medical Education and Royal College International for workshop facilitation. And I have some salary support to do this work. And of course, I do, like many of you, have some biases to declare. So I believe strongly in everyday leadership, and that everyone has a leadership journey, regardless of stage of training. I do feel that leadership education, we've made a lot of progress, but we still have a long way to go. And the journey is complex and is not easy. So you've heard a little bit about about me and my why, and I'd like to understand a little bit about what you see as why leadership education is important to you. And Catherine will be posting the direct link, or you can go to mentimeter.com and use the code as you see there, 11380671. And we'll start to see some of your answers pop up. So why is leadership education important to you? Why have you made a commitment, I hope, to leadership education, or hope to make a commitment? And if you haven't yet, I hope that I'll convince you of its importance after this session. So I see a commitment. So that may be commitment to healthcare, to your patients. It'll provide some strengths and success. Yes, very much around care. Concepts of efficiency and effectiveness. Teamwork is really coming across as strong. It may be about mentorship, equity, and really having an impact. So I'll give it another minute. So it's a must. It's good to know that I don't have to convince everybody in the room. It's about empowerment. Yeah, lots of concepts around care, caring for patients, caring for their families, caring for our health system. Yeah, really being able to make transformation. That may be our physical health. I see a specific mention of mental health, and in many parts of the world, certainly in Canada, that is something that we are really struggling with, mental health, both, of course, during the pandemic and before. And yes, I also see working on public health. Thank you. That's a wonderful list, and I'll share this list with you afterwards. You certainly are welcome to continue to input into that poll. So what I'm hoping to cover today is we'll talk about the benefits of physician leadership education. I think what we shared today will be very relevant to all healthcare professionals. And this is across the entire educational continuum. So that means medical students all the way, and health profession students, to residents, to practicing physicians, all the way through to retirement. We'll explore some options that are available to do this development locally, nationally, and internationally. And most importantly, I think we'll be able to explore your why for leadership education. So I'll provide a little bit of our Canadian context about the why of leadership education and its importance. As many of you shared in the poll, it's really about enhancing patient and caregiver outcomes. And so in Canada, we have consulted with, certainly with organizations, with learners, with faculty, with clinicians, and of course with patients and families. And in the context of undergraduate, postgraduate, and continuing professional development, leadership education has seen it as one of the key priorities in terms of how to enhance our education and healthcare itself. And I'll have Catherine, will have some references in the chat for you in a moment. When we look at accreditation standards, certainly this has also been seen as a must, as somebody outlined in the poll very nicely. And it says that the curriculum must provide educational activities to support the development of each student's professional identity, core attributes, professional responsibility, and leadership skills, as one example at the undergraduate level. We have, in 2015, we underwent a review of our medical education frameworks, and we're starting the process for the 2025 review at this time. And I'll talk a little bit more about the CanMeds framework. And of course, there's been numerous literature, including this article from the on behalf of the Canadian Society for Physician Leaders, talking about our responsibility as healthcare leaders. So why did we? So we actually changed the name. It was originally manager, and we changed the name to leader for a number of reasons. The first being we wanted to really inspire physicians to become engaged in improving patient care and the healthcare system itself. We wanted to engage in terms of the responsibility and taking action to improve the health system. And last but not least, to encourage better contributors to the health system. So that's a little bit about sort of the framework and different lenses. More recently, we've all been immersed in the pandemic, and at the Canadian Health Leadership Network, which is a consortium of a variety of healthcare organizations across Canada, we conducted some research looking at exploring the leadership lessons through the pandemic and looking at how we might learn from the pandemic and in terms of how to improve the health system. So there were 5 themes that you see here: psychological well-being, integrating diverse perspectives, looking at adaptive and agile leadership, being aware of the systems that and our context and culture. And then last but not least, really making sure that we make room for innovation. So what are some of the implications of this research? So as mentioned, I work in the space of health leadership education. I focus on learners. And I think in the context of everyday leadership, this means that everyone has the capacity to influence, and it's about the right leader at the right time for that particular context. So when I think about the theme of well-being, I'll go through each of these individually. I really think that this is about educating us how to be relationship-centered. That may mean mentorship, peer support, sponsorship, coaching, and really team development. And it's all in the context, of course, of a caring environment. It's also around ensuring a sense of belonging and inclusion, which will mean that we actually co-create the work that we do in leadership education with our learners, and also engaging community and our patient partners. The next theme around the importance of integrating diverse perspectives. And when I think of this, I think of it as social justice. This means listening to diverse voices, and it means advocating for our patients, their caregivers, our learners, the care team, all the way through to our organizations and systems. And we need to work towards allyship and really acting in radical solidarity. And these are around themes of anti-racism, anti-discrimination, anti-oppression. And then when I think about the last themes, this is 3 themes in our research. It really was summarized by the concept of complexity. And in this context, I think we need to teach around change leadership and innovation, and really foster a growth mindset. And we really need to think about how we actually change structures and processes and policies and how we make decisions. I recently came across this in terms of my why. So the Faculty of Medical Leadership and Management in the UK actually just published this, and Catherine will also post the link in the chat. And so they formed a document that is their leadership commitment to junior doctors, or we call them residents in the UK. And this was published in the September of 2021. And it really outlines some simple steps that organizations can take to improve the exposure of residents to clinical leadership. And I really like its stepwise approach and the tips that it gives and how we can enhance this. So at this point, I'll just pause to see if there's any questions for clarification. I don't see any in the chat. But feel free to use the raise hand function or to post a question in the chat. So I'm not seeing any. So I'll move on. So we'll be doing a little bit of work in small groups, probably of 2 and 3, and we're going to explore about finding your why and identifying work that is meaningful. So when I think about when we find our why, it means exploring our strengths, our interests, and our values. And today we'll focus a little bit of time on your values and your interests and passions. And this is important because in order to be effective, your leadership needs to be aligned with the context in which you work. And so we need to think about how our values are enmeshed with your team and your organization. So Catherine is inviting, so just before you move into your breakout rooms, she'll put in your task, and there's a link to a set of values. You can find these anywhere. This particular set is from Brené Brown, who's a renowned author, and from her book, Dare to Lead, and this is an open access list. And what I'll have you do is, Catherine, if you could put them into groups of 2 or 3.
Oh, okay.
What I want you to do is you're going to pick a core value, and then you're going to discuss with somebody in the room about why this value is important to you. Are there any questions about the task? I see some people already in the room. So we'll close the breakout rooms and then we'll reset them up. Oscar and Catherine, let me know if their questions pop up. I'm not seeing any in the chat. And I'll invite everybody to take a moment to review the list and pick one that really resonates with you as it comes up. I've opened the room, so please accept the invitation. You'll be in groups of 2 and 3. And you should see an invitation. If you don't see one yet, then please go to the bottom banner, and it should take you to that breakout room. Move some people. So please accept the invitation when it's shared with you. Catherine, if you could help move some people who are in the room by themselves.
Of course, Doctor.
I'm down to room 16. Maybe you could move room. I'll move room
I'll
19.
start from the bottom.
Sure, I'm moving room 19 to 24. So welcome back, everybody. Is everybody back, Catherine?
Everybody's back, Doctor.
Excellent. So thank you for trying that out. I hope you got a little bit of chance to reflect on your own values, either on your own and then share with others. So I'm curious what that was like, if anybody could share in the chat. You don't have to tell me what your value was, but I'm curious whether it was a worthwhile exercise sharing a little bit about yourself and what your values are, what you value. You're also welcome to unmute your microphone and share. So it was nice to hear a different perspective. Yes, very true. And I think it's, something to reflect on. It's like when you're, many of you are working within groups and teams and thinking about understanding how your other team members or your leaders, what they value is a great team building exercise and a way for leaders to engage and understand their team when you have these opportunities for shared dialogue. So there was an ethics discussion. Would you like to share more about that? Any details about the what part of ethics were you discussing? Or is it because there was the value of ethics being important? Yes, and thank you, Chandra, thinking about the intersections of what is meaningful work. And thank you. Yes, it's very, I think empowering might be a phrase when you hear from others who have the same value. I think the other interesting thing is words have very different meanings, I'm sure both in Spanish and in English, where the meaning that we give the word, for example, you brought up ethics, may mean very different things. And so that's why for that reason alone, it's important to have that dialogue with others, because even if the team all has the same value, understanding their framing is incredibly important. So thank you for sharing. So in terms of, hopefully that started the process, if you hadn't already explored it, about about your why. Just to emphasize, there is no one right value. And yes, at the end of the day, it's your core is about, as we've alluded to, is justice to improve care and improve education in our context. One value isn't better than another. And as mentioned before, it's important for you to consider the alignment of your values with your team and organization. That doesn't mean that they're the same, but it is important to understand what they are. And if they're very different, then you have to think about what your next steps might be. So then the other intersecting part, and I didn't want to talk about strengths because I hope you know some of your strengths, or that you'll share that with your mentors and mentees about what their strengths are. When I think about interests and passions, it's important to think about where you have or want to have influence. And that you've already talked about, enhancing the lives it's important to think about both self and others. And those others are varied: patients, caregivers, families, teams, colleagues, your peers, all the way through, of course, to society, communities, and our planet. And so your why may be embedded in improving many things, big or small. And you can think very narrow or very broad. And when I think of this, these are some of the many things that are embedded in some of my why and some of your why. So that might be things from climate change, gun control, the need to mask during COVID. We've talked about justice and Black Lives Matter, work hours, curriculum change. Could be around burnout in medical students or burnout in residents and faculty, and all the way to resident selection. So the list can go on. And so thinking about where your interests and passions lie may help you focus your leadership development. So I'll pause here again if there's any questions, either via the chat, or feel free to use the hands up button. Or if you turn on your cameras, you can also unmute and share. Oscar, you had a question?
No, not really. No, but
Okay.
the thing is that one of the things that you mentioned was alignment with our institution, and that's very clear that we have to align to our institution, and also respect the diversity of the ways we think. We think differently, and we have to respect and take advantage of those things. So I don't know if you want to mention some of that.
Yeah, I think it's also important that collectively we hold our organizations accountable to the values that they espouse. So if and hold our leaders accountable and teams accountable to that. So, if your value is, and there's so many, but if your value is around accountability, then what are the steps? If you say you value equity, diversity, and inclusivity, do you have diversity in your leadership? Do you have, when you think about awards, are they the award winners representative of your community when individuals are nominated? Your selection processes, are you ensuring that your selection processes are and policies and procedures are respectful of equity, diversity, and inclusivity? And that may mean something as simple as when you have a call for nominations, do you put, do you ensure that your language is inclusive? Do you talk about the fact that you value equity, diversity, and inclusion? So it really is, when I think about social justice matters and how that comes into play across organizations, teams, and us as individuals, it's really in everything we do across medical education and healthcare. And so it's very much a, you'll all have a sphere of influence in that sphere as one example. Not sure if that helps, Oscar.
Yes, thank you.
I should also say that should there come a time where you don't feel aligned with your organization or your team, then that might be a signal to you that this might not be, in whatever context at that time, might not be the right place for you. And so I think that's, for me, that's also a very honest reflection on what roles, what jobs I take and what I advocate for. So I think it is important to consider that as well on the other side. So thank you for the question. And yes, I appreciate the comment. Yeah, education is really a matter of social justice.
Because there is a lot of things that we have received. So it's a matter of justice to give it back and improve or the care and the education. We have to collaborate and make a difference. If we don't, if we don't improve our institution or the education, the care of our community, then what are we doing? That's
Yes.
we're lacking in our leadership.
Exactly, and I think for those in the healthcare education sector, I think we believe passionately about if we improve education, that will also improve healthcare at the same time, as one of our fundamental whys. So thank you for that and for the further discussion. Moving on to our second objective and thinking about, well, how might we do some of this and what are the opportunities? So healthcare leadership education, as I mentioned, I believe it's important across the learning continuum. You will see opportunities to develop leadership education that's within each of these silos, or they might be opportunities that are open to students all the way through to faculty. As mentioned, collaboration and partnership is incredibly important. That may be between institutions or at a regional level, if not national and international. And that might also be in the context of a single or multidisciplinary, as well as multi-professional. You may also think about collaborations and partnerships with groups and organizations outside of health and healthcare. For example, business schools is a classic example. And delivery is very varied. You have, there are episodic opportunities, might be a short-term block over a few weeks. Some are longitudinal every month, and they can be more formal and informal. And I'll share just a few examples. There are many more, and I hope to hear a little bit about what is happening in Monterrey and in Mexico and Latin America. So personally, my own understanding around this has evolved. There's a lot of emphasis in many programs on leadership development for some. It's been a bit of a teeter-totter, and for me, as I mentioned, I believe that everybody needs leadership development, and so the programming is certainly increasing in Canada and around the world. And I think now it's about leadership development for some, meaning our leaders, those with titled roles, as well as and leadership development for all. So looking at some undergraduate opportunities to share. Actually we started the planning last year, but it was implemented in this spring of a 3-week duration. There's a link here that I'll share later, involving large and small group discussions for our final year medical students. And it was based on a national advocacy and leadership curriculum that was led by students with faculty support. And we also have we've had for a number of years now, I believe since 2016, a leadership selective, again, for final year students. So that's something that we have at the University of Manitoba. Across Canada, Choosing Wisely Canada, which is our national body looking at resource stewardship, they developed a one-day intensive for students and trainees advocating for resource stewardship that they call STARS. And 2 medical students from each of our 17 medical schools across Canada are invited to participate in this one-day curriculum. In the postgrad realm, there are many opportunities. In the Department of Pediatrics, we've had, I believe we're going on 19 years now. We've developed and implemented a transition to senior residents so that all pediatric residents go through this one-day intensive. It involves case-based discussions as well as simulation to help prepare residents who are transitioning to the senior role. I'm also involved. So this is a Canadian program that also involved here in at the University of Manitoba. This is a 2.5-day curriculum. It's mainly for chief residents. So again, going back to those with titled roles, and it's general pediatrics, subspecialty pediatrics, as well as our genetics and neurology colleagues in pediatrics. And internal medicine has been running this for much longer. We've been doing this in Canada for 20 years. Many of you know and have been involved with the International Conference on Residency Education that's held each fall. We're hoping that 2022 will be in person. And we do have a specific resident leadership stream that is fully integrated with the conference itself. So some faculty opportunities. One that I'm particularly proud of through the Canadian Association for Medical Education is our Canadian Leadership Institute for Medical Education. And this is actually specifically for medical education. And we just launched earlier this month a brand new iteration, 3 days with a day dedicated to social justice and the theme of bias, equity, inclusion weaved throughout the 3 days that just launched virtually. There are, of course, many joint opportunities across the continuum, as well as multi-professional opportunities. I do want to highlight a couple, both that I'm a part of. So LEADS Global, LEADS is the leadership education framework that we use in multiple sectors across Canada in the health field. And it's based on a framework by Graham Dixon and Bill Thole called LEADS in a Caring Environment Framework. Oscar mentioned that I'm part of Sanocondu, and I am the current chair of the leadership and governance team. This is a multinational group. We are forming a community of practice, and we're really about learning, mentorship and networking together, as well as peer support. Our work started in developing open access resources, and there are 9 modules that are open access. We believe strongly in co-creation, collaboration, and partnerships, and have been running monthly events that I invite all of you to join if interested. And I'll put in the link in the chat. We have an annual summit that's been running since 2014, and we have monthly series. One is actually led by medical students, as well as monthly critical dialogues looking at issues of social justice and the intersection with leadership. And so if you go to that site, you'd be able to see more about these events. Oscar, you had a question?
Everybody can join the meetings.
Yes,
Okay.
they run at all different times. In fact, we had some colleagues from Mexico presenting recently. Many of you know Melchor Mendiola Sanchez, who was one of our co-presenters recently. So I look forward to both perhaps an opportunity for some of you to present your work and also to join in these dialogues on a monthly basis.
Thank you.
Sorry, I'm not sure how I got muted. Now I'd like to explore a little bit about your local context, both in Monterrey and Mexico and in Latin America. So I'm aware of several examples. I'm sure many of you have been part of the Latin America or LACRI Residency Education Conference. I was fortunate to be part of resident leadership event in Colombia, as well as in Monterrey with you all. And then more recently, there's also been opportunities about faculty development in the arena of leadership development. So those are some examples. So I'd love to hear a little bit through the chat, or you're welcome to raise your hand and share verbally. What have been some opportunities for leadership development at any level, in your department, in your school, collaboratively or individually, and of course, nationally? So I'd love to hear a little bit more.
Could you mention some of your participation with us on a workshop for chief residents? You've already collaborated with us, I believe it's twice. One you were here, then the other one was online.
That's right. Yes. Yeah. Through the Royal College International, I've had the privilege a few times now to join the chief residents across your school, which was a wonderful opportunity to engage. They were a fabulous group in terms of, so I think we spent 2 days on different workshops in key themes that each year the residents shared with us based on needs assessment. So those might be topics across things like change leadership, feedback, managing and negotiating conflict as a few highlights. I think time management and building morale and team development were also part of the discussion.
Thank you. Because it was a wonderful experience with our chief residents, because they all also they are a leader on their peers, so it's very important to have these kind of workshops.
Agreed. Yes, and I think personally, I don't think it's ever too early. So those are that was an opportunity for chief resident development. I think there's certainly opportunities to develop as first-year residents, as medical students. And I think, individually, many residents shared that they had leadership opportunities, had leadership roles, before medicine and all the way through residency at different levels. And of course, the faculty equally had very broad experiences.
Could you mention also, take a few words of mentorship? Because we as a physicians and as educators, we have a role as a leader, but also it's a mentor. So that, and then that's another aspect of the leadership. Could you
Yes,
mention
sure.
something about the mentorship?
Yeah, and I think I talked a little bit about that in terms of the, developing a sense of belonging and psychological safety earlier when I was talking about some of the research. I do think that, so a lot of times when we think about resident or faculty or student leadership development, we really think about, what workshop, what are the didactic knowledge pieces. I think so much of leadership education is experiential. And to do that, that means that they must have opportunities and opportunities for feedback and opportunities to be mentored and supported. So mentorship is is an incredible tool to support leadership development. So that whether that be peers or faculty, and really an important component. There are both value to, I think, formal programs as well as informal mentorship. And I would really say that mentorship is needs to be viewed as a palette of paints. You need usually need more than one mentor to meet your needs across the diversity of what you may be passionate about. I don't know if others have had different experiences or anything else, other things to add.
Thank you, Ming-Ka.
Now there are some, I'll need some translation of what's in the chat. I see there's an article. And then if Oscar, you could translate for me what Francisco is saying.
Well, Francisco was saying that we need the link to the evaluation of the session.
Okay.
So
for sure, yes.
Kathy will take care of that.
Yeah. So I look forward to reading this article. And for those that you don't know, if you open the last open chat box, there's 3 dots on the far right, and you can all save chat to capture the article if you haven't seen it. So at this point, I am moving on to questions. If there's any questions about what we talked about.
We are running out of time, and we want to thank you for this opportunity to reflect and meditate about our responsibilities as a leader. And I was just would like to ask you if you give a final message to our audience.
Well, I hope I did want to acknowledge some of my colleagues in the work that I'm doing, including the CHL Net research team. I hope that I've been able to convince you of the importance of leadership education, and that we've been able to explore your why that it would be important for you to engage personally, as well as encourage others in your sphere of influence to engage in leadership development for all the reasons that you've shared over this hour. So it's been wonderful to learn from all of you and with you. And I appreciate your commitment and your time. Thank you. And thank you for the invitation.
Thank you, Ming-Ka. It was a pleasure and an honor to listen to you and to be able to think about our whys, because sometimes we don't have the opportunities, or we don't give us the opportunity to think about why our leaders, why our educators, and what's our goal as a leader. So I really appreciate you and thank you very much.
Thank you. Yes, reflection's always important to have those moments.
Right. Thank you very much. Y muchísimas gracias a toda nuestra audiencia. Les recordamos llenar la encuesta de satisfacción y regresaremos. La próxima sesión será hasta el año que entra, será el 12 de enero. Tendremos una pausa y nos vemos hasta enero. Muchísimas gracias por haber estado con nosotros el día de hoy y que tengan un excelente día. Gracias. Thank you, Ming-Ka. I think our meeting is going to be not today, I think, because I haven't had the response. So
no worries. I can always use a gift of time.
Okay, we'll write you and you know, make the appointment to meet you. Okay.
Sounds wonderful.
Okay.
Thanks, everybody. And thank you, Catherine, for your technological support. And I see there's a Google form. Is that the evaluation?
Right.
For folks?
That's right.
Yeah. Thank you, everybody.
Thank you.
Take care.
You too.